Hello, I'm Marcus Gropper. I'm one of the consultant ophthalmologists at the age-related macular degeneration unit in Amersham and Stoke Mandeville. Today I would like to give you a brief overview about Charles-Bonnet syndrome. So first of all, what is Charles-Bonnet syndrome? It is a condition where patients with visual loss get visual hallucinations. So in other words, if a patient loses vision and it doesn't quite matter how much vision is lost, it is possible that these patients see things, patterns or objects that are not there. Usually it falls into two different categories. Firstly, the perception of patterns. So in other words, that a patient looks at a wall and can see a wallpaper pattern or a grid pattern. The second form of hallucinations are more complex hallucinations, and these are objects, animals, or even people. It is possible that they are either stationary or can even move. So who develops Charles-Bonnet syndrome? So anybody who develops visual loss, and that might be central visual loss where the visual acuity is affected, which is the most common type of patient that develops this, or even patients who still have relatively good visions but lose out large parts of their visual field. Most patients we see are patients with age-related macular degeneration, but that is because there are unfortunately so many of these patients. But patients who suffer from severe glaucoma, had previous trauma, have very dense cataracts or damage from glaucoma can develop Charles-Bonnet syndrome. It is mainly elderly patients who develop it, but purely because these conditions are more common in the elderly. But it doesn't stop children from developing Charles-Bonnet syndrome if they develop vision loss. So where does the name Charles-Bonnet syndrome comes from? And the name originates, and it's named after a Swiss writer and philosopher who lived about 250 years ago. And he noticed that his grandfather, who unfortunately lost vision after cataract surgery, started seeing objects, and especially the mountains, which he couldn't see because he was blind. And he spoke a lot to his grandfather and realized that patients with low vision or no vision start occasionally seeing things which they shouldn't be seeing with their visual level, and realized that were visual hallucinations in patients with low vision. Yeah. So what causes Charles-Bonnet syndrome? So we are not entirely sure what the actual cause is, but the idea is that the back part of our brains, which deals with all the visual information, is continuously active. And this general activity is then overlaid by the visual information coming from the eyes. If this visual information is not provided because there's reasons for low vision or blindness, then the brain does not get enough information to keep itself activated with this information, and goes back to the background level and literally produces information which a patient then can become aware of. So what kind of things might you be seeing when you develop Charles-Bonnet syndrome? Literally everything is possible. As I said earlier, the most two common things is either patterns, and one can think about it like a wallpaper pattern or a grid pattern on walls, on objects where there's normally no pattern. And the second most common things are complex hallucinations, namely objects, animals or people in the room. They quite often can be of a nature that they are different to reality. That means that people are miniature people, that the animals are smaller or bigger than normal, so that the patient knows it is not real and can distinguish between reality and the Charles-Bonnet hallucination. But occasionally it can be quite real and then sometimes quite debilitating. For example, if patients see people in their flat, in their house, and they are real size and don't quite know what is going on. One thing is that these hallucinations normally don't come with any audible hallucinations, so you will not ever hear animal noises or somebody speaking to you. It's a purely visual hallucination. So in summary, patients can see literally everything, but patterns and objects in rooms are most common. So one question we get asked quite often is, do these hallucinations change and do they disappear? Quite often Charles Bonnet syndromes and the hallucinations actually is getting less and less, or patients develop methods of how to restrict the hallucinations. And that is potentially possible because they normally appear when a patient is in a quiet environment and their brain isn't very much stimulated. But in general, Charles Bonnet syndrome has a tendency of actually reducing over time. Is there any treatment for Charles Bonnet syndrome? Unfortunately, up to date, there's no known treatment which can stop the hallucinations. There are early trials with electrical stimulations to see if stimulating the brain with an electrical impulse can improve the situation, but this is really baseline work, so nothing is in practice. Whereas there are certain techniques patients can develop and learn how to reduce the frequency of their hallucinations or to stop them when they happen, namely certain concentration techniques or making sure that their brain gets occupied with other stimuli, and by looking at certain objects at a certain distance, but that might be different for every patient, and our local eye care services usually can give a bit of advice on it. But in a nutshell, there is no proven treatment for Charles Bonnet syndrome at the moment. I would like to talk about coping with Charles Bonnet syndromes. Having a hallucinations can be frightening, particularly when the patient is dealing with losing of their vision at the same time. Although the hallucinations might not be frightening in nature at all, it is completely natural to feel anxious and confused by getting something you never had before. Therefore, it's really important to be open about these hallucinations and to get the information. We're hoping with this information on the video here to be able to give some information even to patients who still have good vision but are diagnosed with age-related macular degeneration, to be purely prepared of what might be coming in case their vision changes. I finally want to talk about the importance of being open about Charles Bonnet syndrome and actually to talk about it with your healthcare professionals and relatives, friends alike. As I said, it can be frightening to experience something which one hasn't experienced before. And the eye care team here and the AMD team is always there to talk about it. Our site care advisors certainly have time to talk about Charles Bonnet syndrome as well. Furthermore, the local charities, the Macular Society or even the national organizations offer help in these cases as well. The main thing is to understand what is going on, because that helps to cope with the situation and to deal with it. I hope you found this information useful.